Hey everyone, Dr. Molina here. Happy Memorial Day to everybody. I just wanted to do a quick video. I know that ABOS Part 1 is coming up. This year it's probably going to be a little bit different due to the post-COVID era. But I just wanted to go over a little bit about what I did to study for ABOS Part 1. And at least in my mind, on how to pass it. There's not a lot of information on board studying for orthopedic surgery out there. I looked on YouTube, Google search. Basically, it's the Miller Review, Orthobullets, and it's really about it. So, kind of my perspective on what to do to prepare for it. First thing is, it's probably a little too late now, but I would start preparing in August at the beginning of PGY 5, and each rotation really, do the Orthobullets questions. Make sure you do the whole blocks if you're doing peds or hand or what have you. Do the block for that, and that way by the time you get to studying in January, February, you've already essentially done all the questions once. And so this might even take you back into PGY 4 to start doing all that if you don't have, the whole block rotations during your PGY 5 year. Second thing I did was I started studying in January. Like I said, it's probably a little bit too late right now, but at least some of the tips in this video you can really start to kind of hone in on these last kind of 6 weeks. So what I did was I started doing all the Orthobullets questions again. I marked which ones I missed and went back over those and did all my missed questions again in addition to the whole block of Orthobullets questions. So essentially did almost 3,000 Orthobullets questions. I didn't use Miller Review that much. I did use it for the pathology section. Depending on what your weak areas are, you could use it for that. I did, however, use Basic Science Academy of Orthopedic Surgery webinar. You might be able to find last year's webinar. They might come out with a new one in June. And that was actually really good. I watched the video and took a bunch of notes. Went over that. Basic science is really hard subject for a lot of residents, so I'd really hone into things that are your weakness. So obviously I was going into spine, so I didn't do a lot of spine questions. I like trauma a lot, didn't do a lot of trauma. And you never know what kind of questions you're going to get. We had a lot of AC joint questions on our test this past year. And a lot of them are third order questions. So it's like so-and-so comes in with this AC joint separation, and ask you some sort of third order question like, what is the plate that you would use for this injury? And one, you have to know what the injury is. Two, know the treatment, and three, what you would use to treat it. So really be prepared for a lot of third order questions. And the test is actually really hard, believe it or not. I walked out of there not feeling super confident about it. I hate to be harsh about that, but it is what it is. When we all took step 1 and 2, we all felt the same way. So again, hone in on your key things. Orthobullets has a podcast that I used kind of when I was driving to and from work or working out at the gym. That was actually really helpful. You could find the old American Academy of Orthopedic Surgery. There was like a test review that they did that somebody recorded. That was actually really good to listen to. Like I said, the Basic Science webinar, and then the Orthobullets questions. There's only so many questions in orthopedic surgery that there's only so many ways to ask them. So if you do the 3,000 Orthobullets questions, I know that sounds like a lot, but it's just something you have to do. You'll essentially cover all the information. It's just a matter of seeing how many different ways they can ask you that same amount of information. So So like I said, no big basic science. I keep harping on that because basic science was one of my weak points. Know all your translocations. That's another big thing. And I essentially made a sheet that I said, okay, when I get my notes or when I get my marker board at the beginning of the test, this is what I'm going to write on it. And I memorized that sheet. So pick a sheet, write down some notes on it, and learn that by heart and say, okay, once I get in the test, this is what I'm going to do to write down these notes that will happen. So I learned all the translocations and wrote all those down. And I wrote a variety of other things down. Hallux valgus angles, they like to ask a lot of things about foot and ankle. So, make sure you learn all the hallux valgus angles and the treatment associated with them. There's lots of good PowerPoints on that. So make sure you learn those. It's really about it. A lot of it is time put into learning the materials. So if you haven't kind of been learning it over the last 5 years, that's not good. People say that the OID is indicative of how you're going to do, and I'll be honest with you, I didn't do great on all the OIDs. I had, some personal issues come up throughout the years, and for whatever reason, just didn't do great on them. But I passed my ABOS Part 1 with no issues. So it's really just about how much time you put into it, and that's why I started back in January. I was on my trauma rotation, the last rotation of my chief here, so don't use that as an excuse. Make sure that you prepare for that ahead of time. So PGY4s, when you're going into PGY5 here in July, make sure you plan for that. If you're going to be on trauma, start studying early. And like I said, do questions. I would do questions all the time. I'd find a quiet place to study. I'd go to work, I'd round, and then I'd go sit myself in a room somewhere and do questions for 3 or 4 hours. And then that was all the studying I did for that day, and I knew that I had already gotten what I needed to get done. I marked how many questions I needed in blocks, so I said, okay, this day I need to do this many blocks of questions. So kind of the same format that I did step 1. So like I said, if y'all have any questions about what you need to study, or where you need to find certain test materials information, let me know. I can try to point you in the right direction. Like I said, there's 6 weeks coming up, so make sure you use this time wisely. Go over the stuff that is going to be hard. Don't be doing spine questions or trauma questions if those are your strong subjects. You need to kind of circle back around and do a 360 review probably the last week, so kind of circle back and kind of hit everything real quick. And really don't concentrate on a ton of questions the last week. Really just that's your time to memorize things. You're not going to memorize something now and remember it in 6 weeks. You need to continue learning what you need to learn, and then the last week or two start learning or memorizing your translocations and other basic science principles, because that stuff's only going to stay in your head for a little bit. So don't be wasting your time doing that right now. So good luck to everybody out there taking the ABOS boards in July, and let me know if I can help. Thanks.